Hi there, my name's Meredith O'Connor, and I head up the Life Course platform at the Murdoch Children's Research Institute in Australia. I started out my career as a psychologist, and working with young people, one of the things I noticed was that young people present not only with their experiences of mental health difficulties, but also a range of mental health strengths. Capacities like the ability to regulate and manage emotions and behaviour, social skills like being able to put oneself in another's shoes, and pro social behaviours like helping out and volunteering. Yet in epidemiology, we've traditionally given very little attention to this positive side of mental health, instead, focusing on where mental health goes wrong. It was great to see the 2020 call from Vanderweel and colleagues for a shift towards positive epidemiology. They highlighted the importance of looking at these strengths and resources that help to keep populations truly healthy. We've been asking similar questions in our work looking at positive mental health, considering the social and emotional skills that help young people to handle life's challenges effectively. When COVID hit, we were very curious about whether positive mental health could be protective for young people during such an uncertain time. On the one hand, with the usual support system stripped away, their strengths might become more important than ever. Young people had to rely on themselves in unprecedented ways during this time. On the other hand, with so much disruption, would these strengths hold up, or would they simply be overwhelmed in the face of these enormous challenges? The Life Course platform is a collaborative research initiative of over 20 longitudinal cohorts. Using data from several Life Course studies in conjunction with the Millennium Cohort study from the UK, we were able to examine this question across national contexts that had different experiences of the pandemic. To design our analyses, we used an innovative approach to the target trial framework to simulate as closely as possible what happens in a randomised controlled trial using harmonised data from these observational studies. Our findings were telling. We found that young people with high levels of positive mental health before the pandemic tended to report lower levels of psychological distress and higher levels of life satisfaction during COVID-19. Interestingly, though, the effects were less clear for health behaviours relating to sleep and to alcohol use. That's a really important reminder that individual strengths alone may have limits to the extent that they can protect adolescent health in extreme circumstances. Looking forward, it's vital that we capture mental health strengths alongside mental health difficulties within our longitudinal studies. My takeaway is that positive epidemiology has a great deal to offer, allowing us to more comprehensively capture both health challenges as well as assets and strengths within the population. Thank you so much for listening, and I now warmly invite you to please read the full paper for all the details.